Mr. Alan Bernard. My name is Ida, and I am a nurse practitioner student from United States University based in San Diego. Today, I am assigned to do your cardiovascular and peripheral vascular examination. Before we start, can I ask permission from you if we could videotape the examination so my instructor could review the process?
Yes, you can.
And then also during the examination, I will be giving you some instructions, and if you feel pain or you feel uncomfortable, just let me know.
Yes, you can.
All right, thank you. So before we start, will you please state to me what's your full name and your date of birth?
My name is Mr. Alan Bernard. I was born March 26, 1965.
Okay, so I would ask permission from you also that when I let you lay down in the bed, I would like to request if you could take off your shirt for better visualization of the process and the examination. Thank you. So the first thing I need to do is take your blood pressure on both of your arms while you are laying supine or laying on your back, and after that record the readings, and then I will take your blood pressure also while you are sitting up, again in both arms, the right and the left, and compare the readings. So the next thing we are going to do is I'm going to check your JVP, which is the jugular venous pressure. Can I ask you to lay down a little bit, please? So I could, okay. So I'm going to prepare the things that I will be needing, and I will put it closer. So I did wash or did my alcohol. So the first thing I'm going to do is, if I could ask you to please turn slightly your head to the left side, and I'm going to stay on my right side. So I'm going to inspect to locate the external jugular vein. So by locating the external jugular vein, I am going also to find pulsation on your neck. The external jugular vein can be palpated, but internal jugular vein could not, because it is deeply seated. I could see palpation in here, in this area. So the next thing I'm going to do is get my ruler and a flat cardboard. I have to measure the JVP by putting the ruler over the sternal notch on a horizontal position, and the other paper or the cardboard will be vertically while I'm measuring the JVP on the highest pulsation of the internal jugular vein. But before I'll start with that, I just want to explain that when the pulsation of the internal jugular vein is lower by the lowest part of the neck, or it's by the sternal notch, I have to request the patient that I have to readjust the head of the bed so it becomes lower, so to adjust the pulsation towards the middle of the neck. Or if the pulsation is higher on the neck, like just below the jaw, I have to put the head of the bed higher, between a 30 to 45 degree angle, so the pulsation moves towards the middle of the neck. So again, let me just put so I could locate the pulsation. All right, I could locate that there. So here is my sternal notch, and with my ruler, and the pulsation is here. So if I am going to measure that, that would be 1.5 centimeter. So normal JVP is 3 and below. So jugular venous pressure is within normal limits. The next thing I'm going to do is to do palpation of the carotid artery. So the carotid artery, actually with men, I have to find his Adam's apple, and it is laterally located on the mid part of the neck. And here you go. I could feel the pulsation of the carotid artery. And when palpating it, we have to palpate it lightly, because deeper palpation can cause some circulatory problems. Then I have to palpate it on the other side, on the lateral side of the Adam's apple. So during my palpation, I should be feeling for the amplitude of the pulse, and I should not be feeling any thrill. And the normal or the expected pulsation should be a +2. The next thing I'm going to do is, I would request you to hold your breath, and I'm going to auscultate your carotid artery. So I'm going to use my diaphragm first, and then I'm going to use the bell. And I'm going to do it on both sides, one side at a time. So again, I'm going to locate the carotid artery. If you can just, there we go.
Hold my breath now.
Okay. Turn to the other side. All right. I should not be I should not be hearing a bruit there, and also I should be hearing a normal normal pulse. So the next thing I'm going to do is do inspection of the chest. So while I'm inspecting the chest, I should be checking for symmetry. I should be watching for any abnormal apical pulsation, and also any abnormal precondylar pulsation, and so far I haven't noted anything. And the next one is, I'm going to do palpation of I'm going to do palpation of the point of maximum impulse, which while my patient is lying down, I have to check for the 5th intercostal space, and it should be on the mid clavicular area. So I have to palpate for the pulse, and again, I should not be feeling, it should feel like breast and tapping, and it should be 3 centimeter in diameter. Okay, the next thing I have to do is palpation of the abdominal aortic artery. So I have to locate it just below the xiphoid process by the epigastric area, but it should be above the umbilical area. So I have located my the abdominal aortic artery, and again, I should not be feeling any thrill during palpation, and it should be 3 centimeter in diameter. So right now, his abdominal muscles, I could feel that it is relaxed. If he is having a hard time to relax, I could request him to bend his knees and pop it up, so it will relax the abdominal muscles. But right now, it is okay because he is relaxed. So the next thing I'm going to do is I'm going to do auscultation. So I am going to request you, probably you could sit by the side of the bed. And what are we going to locate is the aortic valve, the pulmonic valve, the tricuspid valve, and the mitral valve. So I'm going to auscultate first the aortic valve, which should be located at the second intercostal space by the right sternal notch. So using my diaphragm for now, so that's the clavicle. So the second, so this is the second intercostal space by the right sternal notch. I should be auscultating for the aortic valve. Okay, on the left second intercostal space by the left sternal notch should be, or I'm auscultating for the pulmonic valve. On the third intercostal space is the Erb's point. On the fourth intercostal space is the tricuspid valve. And the fifth midclavicular area is the mitral valve. So sometimes, you know, when the breast is larger, we could request the patient to lift it themselves, or if we have a woman as a patient. And also, I will be auscultating using the bell of my stethoscope in the same spot. So the second intercostal space on the right sternal notch with using the bell, and then on the left second intercostal space for the pulmonic valve, and then the third intercostal space for the Erb's point, the fourth intercostal space for the tricuspid valve, and the fifth intercostal space by the midclavicular area would be the mitral valve. The next thing is we are going to auscultate for the S2 splitting, which is here well on the base of the heart. And the reason why there is an S2 splitting, which sometimes considered as a normal S2 splitting when it is here during inspiration, it's because the aortic and the pulmonic valve did not close at the same time or synchronously. Okay, the next thing I'm going to auscultate is the abdominal aortic artery. So the same as earlier, I have to locate the xiphoid process by the epigastric area, and then I'm going to auscultate for the aortic abdominal artery. Okay, I should be hearing a normal pulse sound, and there should be no bruit. Okay, so next thing that we are going to do, I'm going to request you again to lay back, because I am going to do the peripheral vascular examination. So first, I'm going to inspect. I'm going to check both upper extremities for color, making sure that there's no pallor or paleness, the same thing as the lower extremity. I have to also feel the skin for warmth. Okay. And then I have to check the lower extremities for presence of edema, and if there's swelling or edema, if it's pitting or non-pitting, and also presence of varicose veins. Excuse me. All right. After inspection, I have to check for the fingernails, for any cyanosis and for any clubbing of the fingers, and also the same on the toes. And then I will go ahead and check for the capillary refill. So with the capillary refill, I have to put pressure or press the nail beds, and when I do that, it will cause some paleness, and then when I release it, the pinkish color of the nail beds comes back, and it is less than 3 seconds. Okay, so capillary fill on the right fingers are good. The same thing on the fingers on the left hand. I'm going to check the capillary refill of the toes. Okay. Okay, capillary refill is less than 3 seconds. I'm going to check the left toes. And the capillary refill is also less than 3 seconds. So the next thing I'm going to do is check for the pulses. So I'm going to start with the radial pulse. I should be using my second and third finger, the flat of my finger rather than my thumb, because my thumb has pulses. So if I will check, it will not be the right pulse. All right, the amplitude or the vibration again is +2. That would be the radial pulse, and there should be and I have the brachial pulse here. Okay, and then I should be locating the femoral pulse by the groin area. And then the popliteal pulse, which is behind the knee. So I will just ask you to just slightly there. And then I have to use 2 of my hands to cup it and check behind the knee, and I could feel the pulse again. It's a +2, which is the expected amplitude or vibration. And then I have to go to the dorsalis pedis. You could see the pulsation here. Okay, and again the amplitude is +2, which is the normal pulsation. And then the next one is the posterior tibial, which is by the medial malleolus. Okay, the pulses, the amplitude are all +2, and there's no bruit. And then I should be auscultating the femoral vein. So I'm going to listen using my diaphragm. Okay. And the next one is I'm going to do the other side of the pulses. Again, I'm going to do the radial pulse. And the amplitude is +2. Then the brachial pulse. And then the femoral pulse again. And then the popliteal pulse with the use of my slightly bend, with the use of my 2 hands. All right. And the dorsalis pedis. and the posterior tibia. All right, so all the pulses are, the normal is expected to be a +2, which all his pulses are. And that ends our cardiovascular and peripheral vascular examination.